My name is Mohammad Bilal Afzal, and today I am going to discuss a case study of canine brucellosis in breeding kennel. If we talk about case history, a female beagle dog aborted at 7 weeks of gestation and it was leased from another kennel 5 months earlier. 14 days before release, it was tested for Brucella canis and it was negative for Brucella canis. It also has direct contact with other dogs in exercise area. Diagnostic findings: culture from aborted fetuses were performed and it was positive for Brucella canis. Vaginal culture was also performed and it was also positive for Brucella canis. RSAT and tumor captoethanol RSAT tests were performed and they were also positive for Brucella. Initial actions recommended after diagnostics: infected bitch should be euthanized and all other dogs should be quarantined. All other contact dogs should be tested with RSAT. Follow-up testing: monthly RSAT testing for consecutive 3 months. All contact dogs should be negative. All kennels should be tested once and should be negative. Disease overview: Brucella canis is a gram-negative intracellular bacterium and it is difficult to eliminate with antibiotics. It's shed in milk and post-abortion discharges up to 6 weeks and it is rarely cleared, so euthanasia is recommended. Zoonotic importance: it is a zoonotic disease and imposes greater risk to humans. Dogs should not be sold or rehomed after diagnosis with Brucella canis. But pregnant women, children, and immunocompromised people must avoid contact. Kennel management: immediate quarantine of kennel, no entry or exit of dogs until complete eradication, disinfect the kennel with quaternary ammonium or iodophors, remove all organic debris before cleaning. Reporting and safety: Brucellosis is reportable in some states. Contact Department of Agriculture for regulations. Personnel must use protective gear and avoid direct contact with urine, lochia, semen, or aborted materials. Serologic testing protocol: use a rapid slide agglutination test for screening because it is sensitive and easy to perform. Monthly testing until 3 consecutive negatives. Positive RSAT confirms with 2 mercaptoethanol RSAT and reconfirm with AGID or blood culture if needed. Diagnostic limitations: antibodies are detectable after 3 to 4 weeks post infection and it can give false negative up to 8 to 12 weeks. Culture and AGID tests are slower and less sensitive early on. If euthanasia is declined, then you have to neuter infected dog and antimicrobial therapy should be performed with enrofloxacin or tetracycline plus gentamicin for 4 weeks. Retest after first, third and 6 months. Relapses are common and dogs remain infectious. Prevention strategies: test all new dogs greater than 6 weeks old twice with RSAT 4 to 6 weeks apart. If the dogs are less than 6 weeks old, negative bacterial culture, 3 samples 24 hours apart should be performed. Breeding or show dogs must test negative before re-entry. Routine screening: closed kennels in closed kennels 2 to 4 screenings per year should be performed and in open kennels monthly testing may be necessary. Maintain strict hygiene and quarantine for all new entries. Outcome and conclusion: no separating the kennel after control measures. All new dogs quarantined and tested for 3 months before entry. Regular monitoring prevents reoccurrence. Key message: early detection, strict biosecurity, and euthanasia of infected dogs are crucial for eradication. Thank you.